Hello there. Welcome to this week's episode of House Calls. Today I'll be sharing with you about the knee. Everyone's been getting more active and doing more things, and this is also a time when we start having more injuries. So I think about this when I think of the young youth athletes that come in and they've been doing their basketball practice in their backyards, or they've been practicing their sprints, or they're doing their own warm-up drills trying to stay in shape for the season. I want to give you a little information about the knee, also the injuries that can commonly happen with the knee for our youth athletes. First off, the knee is a simple yet complicated joint. It involves muscles, ligaments, tendons, and bones. First off, a tendon connects bone to muscle, and a ligament connects bone to bone. Here in this diagram, you see the bone at the top, which is sort of covered by muscle, is the femur. The lower bone is the tibia. The muscles that lay right above the femur are called the quadriceps, and they're named that because there's 4 of them. There's the superior, inferior, and medial and lateral. Those all come together to a confluence where a tendon connects them to the top of what many people call the kneecap, but we also call it the patella. The patella then has a tendon that connects it to the tibia, which is that lower bone on your leg. These muscles and those tendons allow you to do the kicking motion of your lower leg. Oftentimes I'll have young people come in either with pain from below their patella or above their patella. If the pain is below the patella, oftentimes they'll be able to point to one spot, and if they press on it, it hurts, or there might be a little bump on their tibia where the pain's been coming from. That condition is called Osgood-Schlatter's disease. It's commonly found in young people, frequently around 11 years old and older, and it happens from overuse, meaning you're running around being active and that tendon's been pulling on the tibia a lot at that spot that sometimes it causes the bone to avulse or break off of the tibia, or it's just putting a lot of pressure on that tendon there. This is often treated with rest and icing in the initial time of your injury, but it doesn't mean you can't participate in sports again. When the pain has gone away, you're able to wear a band on that part of your tibia, which holds that tendon in place, and that helps relieve the discomfort you may get from running and when you're doing your sports activities. When there's pain above the patella, and it's the similar symptoms as we see in Osgood-Schlatter's disease, it's another condition named Sinding-Larsen-Johansson syndrome. From the name you can tell it was 3 people that found it. Same type of injury, because now you have a lot of stress on the tendon between the patella and the quadriceps, and this time it's not pulling off at the bone, it's just pulling there in between that causes pain. It's also treated the same way we do for Osgood-Schlatter's disease. So that's briefly the overview of the front of the knee. On the sides of the knee, we have ligaments. The medial collateral, meaning on the inner side of the knee, and the lateral collateral on the outside of the knee. Those are the ligaments that help stabilize the sides of your knee. So help make sure that your knee, if this is your femur, isn't sliding side to side. If those get torn, that can cause pain, and oftentimes rest and allowing yourself to recuperate from it when you're young will help it heal up. Only sometimes if it's been a very, very ugly injury will it cause a situation where it may tear and would require surgery. So that's a brief take on the front and sides of the knee. Now I'm going to talk a little about the inside. This is a cutaway where they've moved the patella up a little and we can see the inside of the knee. Again, on the top, that's the femur bone. On the bottom, that's the tibia. And you see these 2 little cushions here. Those are the menisci, or singular meniscus. The medial is the inner side, the lateral is the outer side. Those act as the cushion between your femur and your tibia in your knee. Oftentimes, people may have pain from there when they're doing twisting motions in activities, and that will give me a hint that I need to check their meniscus by doing an exam maneuver to check that area. A meniscus tear can possibly require surgery if it's severe enough, and some just require some rest and allowing it to heal. On the inside of the knee there, you see a little X. That is where we see the crossing of the cruciate ligaments. There's the anterior and posterior cruciate ligaments. Usually, these are supposed to be pretty hard to damage because, as you see, they're in the middle of the knee on the inside and they're protected. But you've probably heard from watching sports over time, you'll hear the broadcaster say, so-and-so is out with an ACL tear or a PCL tear. That's shorthand for anterior cruciate ligament and posterior cruciate ligament. Usually, if someone has torn one of those ligaments, they had a very severe type of mechanism of injury where their leg was twisted, pushed, something really just bad happened, and that usually has to be treated with surgery. So that's just a brief overview of things about the knee. But with most of the injuries to the knee for youth athletes, first thing is treating the pain when it first happens, then allowing your body some time to heal from it, and then slowly getting back into your physical activity. If you've been experiencing pain or discomfort from your knee, or if you've been doing something and you think you injured it, it's best to speak with your medical professional about it and see if there's treatments that you could use at this time. Thank you for spending some time with me today. Feel free to send a message if there's a topic you would like to have addressed during house calls. Again, take care of yourself and those around you, and I'll catch you next week.